Once we have done the laparoscopy, we have tried naturally through intrauterine inseminations and ovarian stimulation for 3-4 cycles. It hasn't worked, then IVF is the way. Also, if her AMH levels are low and she has failed a laparoscopic surgery previously, in these two cases also, IVF would be the next step for us to consider. So IVF for endometriosis again is a very complex thing. As we've understood, your ovaries might have cysts, your tubes might be swollen up, or your womb might be all big and bulky because of the blood collection. We need to take all these three aspects into consideration while doing an IVF. If the tubes are swollen up with dirty fluid inside, with menstrual blood inside, there is a high chance that that fluid might regurgitate back into the womb and not allow for the IVF to succeed also. Then we need to go for a laparoscopy and remove the tubes so that this dirty fluid cannot come back to the womb. This is known as surgery for hydrosalpinges before going for an IVF. There's a lot of data, a lot of information that this actually increases the pregnancy rates. If the womb is bulky, then there's a chance that the blood supply to the womb is not reaching properly and she might have miscarriages or poor implantation, in which case we need to reduce the size of the womb. Unfortunately, there is no good surgery for this. We need to stop her menses for some time, insert something called the Mirena, which is an intrauterine device, or give her an injection of GnRH analog, which will stop her menses for 3, 4, 5 months, and that will help us shrink the uterus. Both of these are temporary measures, and they should be done once we have been able to take out the eggs, because this might take longer and this might reduce her ovarian reserve further. So my classical protocol as far as IVF for endometriosis is concerned is to start her IVF as soon as possible, giving her injections to produce as many eggs as possible, collect them and form embryos. Once you have formed embryos, then go for the tubal surgery in case the tubes are swollen, or give her injection GnRH analog, or put a Mirena inside to help her shrink the uterus if the uterus is bulky. All this might take as little as 3 months and as long as a year. We have to allow that time. Once the uterus is shrunk, maybe not to the normal size, but maybe a little near normal size, that's when we thaw, that is, warm up the embryos that have already been vitrified or frozen, and then use those embryos to be put back to the womb. So although it may sound a lot of time, but this actually gives you a very good chance of taking back a pregnancy or a baby home. So as we understand today, endometriosis is tricky, but in these times that we are in, medical science definitely has a solution for most of these women suffering from endometriosis.